Perfect.
All right, so hello everyone. Welcome to BIAR's Educational Talk series. Today's topic we will be covering pelvic health, dysfunction post brain injury. Our lovely guest speaker joining us today is Zeina. Zeina is a registered physiotherapist. We'll be covering a few key main topics, and those include pelvic floor and more autonomy anatomy review, a neurogenic perspective of bladder function and dysfunction, keys to optimal bowel health, navigating sexual health challenges, and the last topic is physiotherapy management of pelvic floor dysfunction. So without further ado, I will let Zeina take it away, please.
Thank you. And hi, everyone. My name is Zeina. As Madison mentioned, I'm a registered physiotherapist. I am also a rostered pelvic health physiotherapist in Ontario. So, again, today we'll be talking a little bit about the intersection between pelvic health and brain injury. And I did just want to start off today's call with really just mentioning a little bit of a disclaimer because pelvic health can be quite the journey. So, a lot of the time, pelvic health and pelvic health physiotherapy really does require a pretty individualized approach. There are a lot of unique, body systems and factors that can influence someone's pelvic health. So if you are currently experiencing any pelvic health concerns, if you have noticed any symptoms, I do really encourage you to contact a pelvic health physiotherapist in your area. And then that way they'd be able to do a really robust assessment and come up with a treatment plan. And you can find pelvic health physiotherapists through the Physiotherapy College of Ontario. So if you go on their website, you can filter the search based on specialty. So they have a pelvic health specialty. You can always go there, and then you can also filter based on location. So just wanted to share that in case anyone was curious about how you could actually get in touch with a pelvic health physiotherapist. Now, today's topics, as was mentioned, we're kind of going to be talking about a few different things. So we are going to start with pelvic floor anatomy and also getting a better idea of some of the organs in the area. Again, pelvic health can be quite dynamic. There's a lot of moving parts, and this is usually an area of the body that we're not super well oriented with. So I do find it helpful to just kind of break down some of the basic anatomy so that we can really visualize these structures as we talk about them. In terms of a neurogenic perspective of bladder function, what that kind of means is we're going to have a better understanding of bladder functioning and also dysfunction, but we're really going to try to look at this from a bit of a neuro lens because obviously we're here for this talk in terms of pelvic health post brain injury. So that's going to be one of the lenses that we really focus on today. Bowel health and sexual health are also very big parts of pelvic health physiotherapy, so that'll be a piece that we talk about. And then finally, we are going to talk about some management strategies. So throughout today's call, if you have any questions, please feel free to drop them in the chat, or you're also welcome to raise your hand. We can try to address questions as they come up, or we'll also have a bit of time at the end where we can have a little bit more of a discussion. Okay. So this is a little bit about the pelvic floor. Now, what we are looking at here are two different models of the pelvic floor. Now, this is a female model, so of course the male model would look a little bit differently, but all of us have a pelvic floor. We all have muscles within the pelvic floor, and this is really situated at the bottom of the pelvis. So we'll first take a look at this picture here on the left. Now, this is kind of a bird's eye view of the pelvic floor. So you can imagine looking down at some of the muscles. So the top here, this is the pubic bone. So that's the bony kind of structure underneath your belly button. At the bottom here, this is your tailbone at the very bottom of the spine. And then we have our hips on the sides. And your pelvic floor attaches kind of like a big hammock. So I almost tend to picture it similar to a trampoline or even a fruit bowl, right? It has the ability to kind of move with our breath and with movement. So if we think about that trampoline analogy, the pelvic floor can relax as we sort of push down. It can also contract as we pull up. So it really does have a full range of motion, just like any other muscle in the body. And just like any other muscle in the body, it's really important that we strengthen these muscles, that we relax these muscles when we don't need to be using them. It's important that we really try to prioritize, a lot of blood flow and oxygen to these muscles, just like any other area of the body. As you can see, of course, there are a few major openings in the female pelvic floor. So you have the urethra. This is where urine would come out. You have the vaginal opening and then the rectal opening. So for the male pelvic floor anatomy, really all we're seeing is the urethra and the rectal opening. We're not seeing that vaginal opening. On the right here, this is just a different view of what these muscles kind of look like and part of their role. So this is that whole fruit bowl analogy that I was talking about, where again, we have the pelvic floor attached from your pubic bone all the way to the tailbone, and it's helping to hold up some of these organs. So that is one of the roles of the pelvic floor, where you have the bladder in front. For females, you have the uterus, you have the bowel in the back, and then for males, you would have the prostate, which lives right underneath the bladder down here. So lots of different roles for the pelvic floor. Of course, one is a bit of a supportive role, so it helps to support these organs. The pelvic floor also helps with circulation of blood flow. So that's going to be a big piece that we talk about as well. Because surprisingly, the pelvic floor actually has a really big role with your breathing mechanics. And this is actually how our body is able to circulate a lot of the blood throughout our system. So we often refer to what we call a sump pump analogy or a sump pump kind of relationship between your diaphragm, your big breathing muscle at the top of your abdomen or the bottom of your ribs, and then the pelvic floor as well. So what you're kind of looking at here is that relationship between your breathing muscles and your pelvic floor muscles. And these two muscle groups are constantly working together. When we breathe, when we exercise, when we, go from sitting to standing, or when you're coughing and sneezing, your pelvic floor is constantly working with your abdominal muscles to really help manage some of that pressure. So that's why when we think about how, pelvic floor anatomy or how some of these muscles possibly kind of change or how we might see different changes post brain injury, is sometimes what we'll see is a little bit of uncoordination between these muscles. Sometimes we'll see that, because of various reasons, maybe activity levels change. And so those muscles aren't necessarily being exercised as much. So, a really big emphasis in pelvic health physiotherapy is not only learning how to use the pelvic floor muscles, but also learning how to coordinate them with other muscle groups, and really how to make it more functional. So I'm sure, everyone has probably heard of a Kegel. A Kegel is kind of the term used to really learn how to actually turn those muscles on. But a lot of pelvic health therapists will also try to emphasize, engaging those muscles and contracting those muscles in addition to, other movements or coordinating it with your breathing mechanics as well. So that's just a little bit about some of the muscles involved. Now I want us to talk a bit about the nervous system and specifically how the nervous system plays a role in your bladder functioning, in your pelvic floor functioning. So that's going to be the main lens that we look at for this slide. Now, your brain, your spinal cord, all the nerves that run through your body, they play a really, really big part in bladder functioning, especially. That's kind of going to be the main piece I focus on for this one. So when we think about how the bladder muscle functions, just like any other muscle in the body, it's receiving a lot of those instructions or messages or signals from our nervous system, from our brain, through the spinal cord, along the nerves. I tend to kind of use the analogy of, your electrical box in your home. That's kind of the brain, that's our central nervous system. All the wires passing through the walls to get to the outlets, those are our nerves. And then the outlet or the light bulb is the organ or the muscle. So that's the one that's actually receiving those messages. So sometimes when we see pelvic floor dysfunction, and that can also include bladder dysfunction, we actually need to assess the nervous system and better understand how possibly the brain is involved, if, there are any disruptions along that entire pathway. So a lot of pelvic health assessments will actually start asking about, brain functioning, about nervous system functioning. We'll ask about inflammation, which is a really big part of brain injury as well. We'll see a lot of inflammation whenever there's any kind of injury to the brain. So that is something that is really important for us to kind of assess from a pelvic health perspective, because that is the main messaging center. Now, in terms of brain injury, of course, there are a lot of different types of brain injuries, different regions of the brain that can be injured. And so that will, of course, have different responses to how it might impact your bladder, your pelvic floor, the bowels as well, because we are looking at different kind of regions and how they control those muscles. But generally, what we might see with various brain injuries is possibly different levels of control for being able to tighten and relax the muscles of the pelvic floor. Sometimes we'll see a bit of disruption in the ability to plan or inhibit urges. So, needing to go to the bathroom, that is something that is also controlled by the nervous system. Our brainstem is a really key part of regulating the reflexes for bladder and bowel. So some of these structures, they're controlled consciously. We can consciously engage the pelvic floor, but something like the bladder or the bowel, to an extent, we can't consciously control some of those structures. So this is where the nervous system plays a really big part. Coordination, of course, can be disrupted or impacted. And then our two kind of branches of the nervous system, your fight or flight and your rest and digest. So those are two really big sort of aspects of our nervous system that can sometimes fluctuate post brain injury. And that will often have a pretty big impact on bladder functioning, pelvic floor functioning, and the bowels as well. Okay. Now, I wanted us to kind of break down the bladder cycle a little bit more, because there are some really key numbers and components of bladder functioning that we can think about to help better assess if we are, maybe seeing any changes in bladder functioning, or even if there are just certain habits that we might want to tweak to really optimize that functioning. So, in general, depending on your fluid intake, your activity levels, on average, we want to be seeing at least 3 hours between voids. So that's 3 hours between needing to empty your bladder. If we see that, someone is experiencing a lot of frequency, let's say they're going to the bathroom, every half an hour or every hour, if they're getting the urge to go very frequently, that kind of triggers us to think about the bladder muscle. It triggers us to think about the nervous system and some of those signals that are being sent to the bladder. And this is where a pelvic health physiotherapist might start to dive into some bladder retraining techniques. Another way that we can kind of measure this is when you're actually emptying your bladder. We want to be able to typically achieve at least 8 MScPT of a bladder void or a voiding of urine. If we're seeing that a void is taking, 2, 3 seconds, that usually tells us that the bladder's not actually filling to its full capacity, and instead it might be a little bit overactive. So again, we might take a deeper look at the bladder muscle or at the nervous system, or possibly some of the other irritants in the area. If, for example, if the bowel is really inflamed, right? Oftentimes we'll see someone might have some bladder frequency and they also have some constipation. So we kind of have to address the constipation because that inflammation in the gut, the inflammation in the bowel, can really impact the bladder simply because the two organs live right beside each other. So they do tend to influence each other. Now, in terms of hydration, this is something that we often see in pelvic floor or pelvic health physiotherapy, is that if someone is experiencing bladder dysfunction, everyone tends to reduce their fluid intake. And water is so, so important for your bladder functioning and bladder health. And what we see is that when we dehydrate the bladder, it can actually make things a lot worse. So, this is where we want to strike a fine balance between reducing bladder irritants, and your common bladder irritants are caffeine, carbonated drinks, so even something like a bubbly or a soda that can be quite irritating for the bladder. Spicy and citrus foods can be irritating. And then alcohol and smoking are some pretty big irritants as well. So ideally, we want to reduce irritants and we want to increase hydration to an appropriate amount so that we're keeping the bladder in this very happy, neutral, hydrated environment. And another big takeaway from bladder retraining is we actually want to try to avoid just in case peeing because sometimes this can really cause a bit of overactivity in the bladder. But this is where you and your pelvic health therapist might be able to come up with the best approach depending on what your symptoms are. Because sometimes we will use different, scheduling techniques for voiding depending on if the bladder is experiencing any neural disruptions. So if we're seeing that, the sensation of knowing when your bladder is full is impacted, then that's where scheduling voids might come into play. But generally, we want to avoid just in case peeing because that can sometimes make the bladder a lot more active than it needs to be. So, this kind of takes me into the different types of urinary incontinence, or basically just the fancy term for leaking, urinary leaking. So, we have stress incontinence or stress urinary incontinence, which essentially refers to any kind of stress or pressure on the pelvic floor. So, this is the kind of leaking that happens with coughing, with sneezing, with laughing, going from sitting to standing, essentially any change in position that can sometimes cause pressure on the pelvic floor and it results in a leak. That would kind of be categorized as stress incontinence. Then you have urge incontinence. And this has more so to do with the brain, the nervous system. So, that relationship that we were looking at between your nervous system and your bladder. Because sometimes what we see is that the brain is actually sending those signals a little bit prematurely, and the bladder is responding to those signals, right? It's that light bulb in the electrical box. So the bladder is contracting and we're seeing a bit of a leak before we've actually reached the toilet. So that's urge incontinence. Mixed urinary incontinence is exactly what it sounds like. It's a combination of the two of those. And then a neurogenic bladder is something that we might see more with brain injury or even with spinal cord injury, where there's an inability to tell whether the bladder has actually reached that full capacity. So now we're starting to see a bit of a disconnect between the nervous system and the bladder's stretch response. And with brain injury, specifically with traumatic brain injury, we do see this occur in about 30% of people based on some of the research. So it is something that is quite common, but there are a lot of different ways in which we can help support clients through, scheduling voids and trying to stimulate as much activity in the bladder as possible so that we're actually able to retrain some of these systems. And we've talked a little bit about bladder functioning, but bowel functioning is just as important. And the digestive system is very intimately connected with the pelvic floor as well as with brain health. So, oftentimes, when someone is experiencing digestive issues, things like bloating, constipation, irregularity, this can really impact the pelvic floor and the bladder, as we were saying before. But when people are experiencing digestive concerns, they are often, likely to bear down and want to push, and that creates quite a bit of stress on the pelvic floor. So again, we're working with the pelvic floor muscles, we're working with the bowel and how that's impacting the bladder. The bowel and your gut health also have a lot to do with hormone release and different body systems. So there's something called the HPA axis, which is basically the relationship between your gut, your brain, your hormonal system, and a lot of other really important body systems and body structures. So this is where brain health and gut health are very much intertwined. So if we're seeing inflammation in the gut, if we're seeing a lot of irregularity in the gut, then it's also important for us to think about, okay, is it, some of that brain inflammation that's contributing, or is it vice versa, where the gut is actually creating a lot of these sort of fluctuations in hormones and cortisol release, and that's then adding to some of the inflammation. So this is a very kind of interesting relationship between the gut and brain health. And this is likely something that you would kind of dive into with a pelvic health physiotherapist to see how you can best optimize gut health as well as sort of tying that back to your nervous system. Now, these are just some general charts that I'll typically use with clients when it comes to actually measuring aspects of gut health and bladder health. So as you can see on the left here, this looks at the color of urine, and this is sometimes how we'll determine if someone is hydrating well enough or if we're maybe starting to sense a bit of dehydration. Ideally, we want urine to still look and smell like urine. It should have a very light color, light yellow tint. It should have a very mild odor. We want to be avoiding these darker colors because that's telling us that the bladder is probably living in a pretty angry or irritated environment where it's dehydrated. So this is where your water intake comes in. And this is the Bristol stool chart. So this actually helps us identify from a bowel health perspective if you are, consuming enough water, if you have enough fiber in your diet. And people are usually pretty surprised to hear that there's actually two different types of fiber intake. So you have your soluble fiber, you have insoluble fiber, and there is an important balance that is needed here because your stool is essentially created by water and fiber. And then movement and exercise are the pieces that kind of move stool throughout your bowels to allow for a bowel movement. So this is where a lot of pelvic health physiotherapists will also collaborate with dietitians, with nutritionists, with naturopaths to really try to address gut health concerns because all of this kind of plays a role in the pelvic floor and how it functions, as well as some of those inflammatory properties that we were talking about. So the main three pillars you can think about is water, fiber, exercise. Those are the three important pieces to a healthy bowel system. Now, this is a pretty helpful technique that's actually really easy to implement. And I usually recommend this for every single one of my clients, whether you have pelvic floor symptoms or not, because this is just a really healthy way of moving the bowels. So what is kind of happening in this diagram here is we're seeing an individual sitting at a 90-degree angle, right? And this is how most of our toilet seats are designed. Now, when we sit in a 90-degree angle, some of the muscles of the pelvic floor can actually be sort of taut. They're put on a little bit more tension because this isn't necessarily the position that our pelvis was designed to empty in, right? If we think about how the human body was designed, essentially we were designed to squat when having a bowel movement. So if we actually recreate that positioning with something like a kitchen stool, What we tend to see is an easier bowel movement where people are less likely to bear down and push. And that's because some of those muscles are in their more relaxed position. So this is a really easy kind of addition that you can start to implement as of today. If you have, a just a small kitchen stool, you can get them from Dollarama. There is an entire company called the Squatty Potty, and they actually design, little stools that can fit nicely underneath your toilet seat. They're a little bit more aesthetically pleasing. But really, the general concept here is if we build up the knees, it can sometimes allow for an easier bowel movement, and then we're less likely to strain. I will say I've even had clients use shoe boxes, yoga blocks, really anything you can think of to kind of get your feet up when you are having a bowel movement. And now I want us to talk a little bit about sexual health and specifically sexual dysfunction after brain injury, because there really are a lot of different body systems when it comes to sexual health. So it's not just about the muscles. Of course, the pelvic floor is going to play a role here, but a very big piece to sexual health and sexual functioning is blood flow and circulation. So this is something where, when you are working with a pelvic health physiotherapist, for example, we might try to incorporate a little bit more physical activity into your routine so that we're really promoting blood flow and circulation. We might work on some pelvic floor specific training, so really trying to strengthen the muscles of the pelvic floor. But there's also a big psychosexual component to sexual health or to pelvic functioning when it comes to sexual health. So this is where we might collaborate with someone like a psychosexual counselor. It's also really important to kind of assess and see, depending on where the brain injury occurred and the level of brain injury. This is where we might need to find a balance between all these different body systems in terms of how that might influence sexual health. But really, the big takeaway here is we need to think about all these different body systems that are involved. So we have the psychosexual piece, the hormonal system, the cardiovascular system, or your heart health, right? Blood flow and circulation, as well as the muscles themselves. And of course, when it comes to something like psychosexual counseling, this is usually an additional service that I will really recommend for clients who are experiencing sexual dysfunction, especially after brain injury, because this is where beliefs and attitudes truly do play a very big role in pelvic health. So this is always helpful to have some additional perspectives and different areas of expertise to help inform the best approach to improving sexual health. Okay. And I want us to talk a little bit about physiotherapy management because there are so many different things that we can do from a pelvic health perspective. So we've talked a little bit about pelvic floor muscle training, and that's essentially the long name for, exercising the pelvic floor muscles. This is where your Kegels come in, but not just the Kegels, also learning how to incorporate Kegels into movement, how to coordinate it with your breathing muscles, and that's the core breath. So that's that example that you're seeing there, which is basically learning how to connect breathing muscles with the pelvic floor. So pelvic floor muscle training is kind of a huge umbrella of using movement as a tool to train these muscles. Bladder and bowel retraining. So this is where you and your pelvic health therapist might actually start to track some of these things in terms of your bladder habits, your bowel habits as well, fiber diaries. So you can really start to track these details, and that gives us a lot of information. An example that I use on a regular basis is a bladder diary. So I might actually have clients, time how often they're going to the bathroom, their output. So the output gives us a lot of information in terms of the volume of urine. That kind of gives us more information as to how the kidneys are functioning and how the kidneys are doing. The central nervous system, of course, plays a really, really big role here. So at the beginning, we talked a little bit about your sympathetic and parasympathetic, or your fight and flight versus rest and digest nervous systems. So this is probably one of the biggest pieces that I incorporate in my practice, which is really finding ways to balance these two aspects of our nervous system. Because oftentimes, if we see fight or flight is really active, which is something that is pretty common, right? If we see a really active fight or flight nervous system, usually rest and digest is kind of lagging behind. And when we are chronically living in fight or flight, this can be a really inflammatory state. So your body releases cortisol, that's the stress hormone. And with those stress hormones, we see more inflammation in the gut. We see, muscles that want to over engage and kind of go into that protection mode. So that's where we start to see muscle fatigue. We start to see, different symptoms pop up. It's kind of the same idea as when we hold a lot of tension up through our neck or maybe even clenching our jaw at night. Sometimes this can actually be a result of the nervous system. Because if the nervous system is in that fight or flight zone, if we're sensing threat, body wants to protect important areas. So that's sometimes where that tension can be coming from. Cardiovascular health, of course, is going to be a big part. So this is where you and your physiotherapist might be able to work on, exercise goals and very gradually starting to incorporate more activity into your routine so that we can actually encourage some of these other body systems. Again, not just the muscle, but your heart health, your brain health, right? So just the mental health component that comes with exercise is so important. So that can really take a lot of different forms. And then finally, referrals, right? So collaborative care is going to be really, really helpful here, whether it be through a naturopath, a counselor, dietitians. The list is quite honestly endless. There are so many different areas of expertise that can be really, really helpful for managing pelvic health dysfunction. So, pelvic floor muscle training, we talked about this a little bit already. The core breath, this is just one example. So, again, this is where you would likely want to work with your pelvic health physiotherapist to really get a good idea as to what kinds of exercises are going to be the most appropriate, but really emphasizing that coordination between your breathing muscles and your pelvic floor muscles. Yoga is another really great practice. There are so many different practices that can be helpful for pelvic health, whether it be yoga or Pilates or Tai Chi. There are so many different approaches in terms of how we can really start to incorporate the nervous system, your breathing mechanics, and the pelvic floor muscles themselves. This is kind of what a bladder or bowel diary might look like. So again, we kind of talked about this, but being able to track the frequency, so the time between voids, the amount of urine that you are outputting. We can track things like urgency, we can track leaking, we can track bowel movements as well. And then, of course, your fluid intake. So that is usually what a bladder diary or a bowel diary might look like. But of course, different therapists use different tools when it comes to this. The nervous system. So, as we said, we were talking about fight or flight versus rest and digest. Sleep is something that is so underrated when it comes to not just pelvic health, but just general health and well-being. So, you and your therapist might work on some sleep hygiene strategies. And honestly, sleep is something that I prescribe quite a bit in my practice, where we try to optimize your sleep patterns, your circadian rhythm, because this is when the body has a chance to heal and recover. So, sleep is a really, really big piece of pelvic health physiotherapy as well. And there are so many different strategies and approaches that come with this. So, whether it be, optimizing some sleep hygiene and some routines and habits before bed, or even connecting clients with, sleep specialists or doing some sleep testing with your doctor or at a sleep clinic, there are a lot of benefits to kind of diving into the sleep component here. Cardiovascular health, we talked about already. So, again, just the importance of exercise here and how blood flow plays such an important role, not only for sexual functioning, but for, being able to circulate fluids throughout the body, for exercising the pelvic floor. There's actually a lot of research that also looks at, exposure to green spaces. So even just being out in nature and being exposed to greenery and the benefits that has on your nervous system and helping to regulate that fight or flight response. So again, some things that I might prescribe for clients are, getting out in nature for a certain amount of time per day or per week. So these are some of the techniques that you might see in pelvic health physiotherapy. And then these were just some of the referrals that I was referring to earlier. So again, naturopaths, dietitians, nutritionists, counselors. There are sexual health clinics as well that really specialize and kind of dive a little bit deeper into sexual health. So many different avenues to explore when it comes to pelvic health. So, some key takeaways from today's conversation is, pelvic health is multifactorial. There are so many different body systems involved. And oftentimes I hear when I work with clients that, Kegels are kind of the only thing that they had been told to try, or, after a surgery or after experiencing symptoms for many, many years, Kegels were kind of the only thing that they were informed to practice. And a lot of the time, Kegels might not even be the main technique that I would use, depending on what the actual concern is. So this is really just to say how multifactorial pelvic health is. And when working with a pelvic health physiotherapist, you might be able to better assess what other body systems need a little bit of attention and maybe how we use Kegels or core breathing or different kinds of pelvic health muscle training or pelvic floor muscle training. But of course, it needs to be relevant to what your symptoms are. Your pelvic health fluctuates as well according to life experiences. So if someone is experiencing one symptom, at one stage of their life, that can fluctuate quite a bit throughout the course of following years. Usually we see menopause is a time where we'll notice an increase in pelvic health dysfunction. Of course, something like prostate health can play a really big role. So this is usually something that we'll see with our clients who are going through that time in their life where they might be experiencing some changes to prostate functioning. So really, it is a journey. It is an area of the body that is important to pay attention to across so many different times throughout your life. And it's okay if these things fluctuate. We're not necessarily looking for perfect pelvic health. It doesn't really exist. It's more so understanding your pelvic health and trying to work with your body if symptoms do come up. Again, this is a point that we talked about at the beginning. Pelvic health really needs to be individualized and it needs to promote a client-centric approach because there are so many systems involved. So, what I might use for one client doesn't necessarily apply to the next. And that's why it's hard sometimes to give, a perfect pelvic floor exercise, or oftentimes people will ask me, if there was one exercise I could practice daily, what would it be? And that's kind of a hard question to answer because everyone is so different and it really does depend on what your body is going through at that time. So that's where that individualized approach is so important. And then finally, everyone can benefit from pelvic health education, men, women. If I have clients from the age of, mid-teens to their 90s. So it really is an area of the body that we need to pay attention to because everyone has a pelvis and it works so intimately with all the other body systems that we pay attention to. So it's really important that we kind of learn about our pelvic health and that we talk about our pelvic health because this is an area where we still see a lot of stigma and we see a lot of hesitation about having these conversations. But the thing that I've learned the most about pelvic health is that once we really start to talk about some of these symptoms and talk about these experiences, it opens up a whole new world and we start to see how many people are actually struggling in silence. So it is really important that we talk about these concerns, we talk about these symptoms, because there are so many different things that we can try to really improve quality of life when it comes to pelvic health. So I did just want to leave my contact information here as well. Now, if you have any questions, please feel free to email me. But I believe we're also going to have some time now to open up the chat and also feel free to unmute so that we can have a bit of a live discussion. But do we want to stop the recording or what are we thinking?